In our special State of Addiction coverage, we dig deeper into America's growing opioid epidemic. Right now, addiction is devastating families and communities in every state. According to the Centers for Disease Control, there were an estimated 66,000 overdose deaths last year, a new and depressing record. But there might be some help on the horizon. Researchers at Walter Reed Army Institute of Research in Maryland are about to launch clinical trials on what could be a major breakthrough in the fight against opioid addiction. It's a vaccine that produces antibodies in the blood that block the euphoria of opioids and reduce the amount of the drug that actually makes it to the brain. Dr. Gary Mattis says it could not only lead to fewer fatal overdoses, but also help people overcome their addiction.
The vaccine blocks the effects of heroin and other opioids. And we also believe that the vaccine would also prevent overdose by decreasing the amount of opioids that can get to the brain in case a very large dose was taken.
There's still a long way to go. Scientists predict 8 to 10 years of further research before the vaccine could be ready for public use. For states with the highest rates of fatal overdoses, like New Hampshire, Ohio, and West Virginia, 8 years is simply too long to wait. They need help now and are asking President Trump to do more. The president has declared the opioid epidemic a public health emergency, but he stopped short of declaring it a national emergency. New Hampshire's senior senator is Jeanne Shaheen, and she says that's been a mistake. She's asking for an additional $25 billion to support treatment efforts. It's nice to have you.
Nice to be with you. And you know, that public health emergency is due to expire on January 23rd.
What tangible results have you seen from that public health declaration?
Well, none, really. The President's Commission has made a number of recommendations that we think will be helpful if they can ever get implemented. But what states and communities need are resources.
So what are you worried about when this declaration expires on the 23rd of January, just around the corner?
Well, that's not going to make much difference. But it is an opportunity to, instead of saying it's a public health emergency, to make it a national emergency. As we saw recently, the CDC, the Centers for Disease Control, said that in 2016, 42,000 people died from fatal drug overdoses. You know, if we were losing people to flu or to Ebola at that rate, there would be a public outcry that would demand help at the national level.
The data says epidemic, 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 and it doesn't feel like people are responding at this moment to an epidemic.
Well, that's absolutely right. And we need help for law enforcement. We need help for treatment. We need help for prevention, for recovery services that people need for a long period of time.
All that would go into that $25 billion that you're asking for.
Well, I think that's a down payment. That doesn't solve the problem, but it certainly would help to make a dent.
In Pennsylvania, the governor there, Tom Wolf, declared a statewide epidemic, which to me read as if it was the states sort of going around the federal government because the feds didn't seem to be acting in a way that they needed to. What does that say about Congress if that's what states are forced to do?
Well, I think states are desperate. I know in New Hampshire, our governor and the legislature put in expanded Medicaid several years ago when we passed the Affordable Care Act, because that was one way to get treatment for people with substance use disorders. And that's made a huge difference. Thousands of people have been able to get in treatment because of that. And we've had things like our Safe Station program in the two biggest cities, Manchester and Nashua, where anyone can go into a fire station any time of the day or night and get connected with treatment. And that's so important because when somebody's ready for treatment, if we don't get them into treatment, then they may not be ready again for months, and it may be too late.
Have you seen an impact to the foster care system, that people addicted to opioids have basically lost the ability to care for their children?
It's been huge. And we have friends who have their 3 grandchildren, and he said to me, if I can only live to be 80 to get the youngest one through high school. So this is what families are dealing with, and the foster care system is totally overloaded. And we're not even beginning to think about the impact on that next generation from this epidemic.
Do you think there'll be a political price to pay for the president?
I hope so. And the fact is, it's not enough to give lip service. Over 100 people a day are dying from overdose deaths because of substance use disorders. It's not enough to say, oh, I'm going to help with this. We need real help. We need resources. I do think history will show that we had an opportunity to make a difference, and if we don't do that, shame on us.
Senator Shaheen, it's so nice to have you. Thanks for talking to us.
Nice to be here. Thank you.